Hello everyone. Today I am going to explain about what are the basic instruments which will be useful for the regular lingual practice. So in that instruments I am going to show what are the basic regular using labial instruments for the regular day-to-day clinical practice and how it will be useful, and lingual special instruments which are there and what is the difference between the regular instruments to these lingual instruments, how it will be helpful for the lingual practice, and what are the bending instruments which will be useful for lingual practice and fabrication of the voice. So first, when it is coming to the bonding procedure, the basic instrument which will be useful is the tweezer. So this is specially designed for the self-lingual bracket. So it is having a clear angulation for the holding of the bracket and engaging directly onto the patient, which facilitates direct bonding in the lingua. So this is for the anteriors which we'll be using. So we will be holding in this way for the upper, and in the lower we will be holding in this way, and this is for the posteriors. So we can place the brackets in this way. So these are the two basic instruments which will be requiring for the bonding procedure, and for the checking of the measurement we can use even the periodontal probe also. And next, the main important thing for the self-lingual, to open the door, because the bracket is a self-ligating bracket, this is the tool which is designed specially for self-lingual. So it is having like curved edge in one side and another side it is having straight. So this curved one is for the upper anteriors, where we are keeping this curved one into the notch, and when we are pressing like this, automatically it will get open. For closing the door, we are applying the tooth pressure. So for the posteriors, we are using the straight one for making it open and for close. So this is the tool which will be useful for bracket opening and closure for the self-lingual. Next is, when it comes to the regular labial instruments and those instruments which we will be using, like either distal end cutter, PLC cutter, or otherwise wheel guard plier, nitration chin plier. These instruments also we can use while practicing in the lingual, but the main problem is the length of the instrument will be less compared to the length of the instrument of lingual. So this is the main difference which makes significantly helpful while doing the lingual practice, because these long arms which will be there will be useful for making the work inside the lingual side. So, and the tips also will be more thin as when it goes to the lingual side, to make the work where the interbracket span is becoming less. The instrument's dimension should become less so that it will become easy for doing the practice. So now when it comes to the lingual instruments, so this is pin and ligature cutter. So this is straight one and this is curved one. So especially when we are doing in the anteriors, when we are making ligation, and after that when we want to make any of the wire to cut, we need to have the curved head so that it will become easy for making the work. So these two are the basic pin and wire ligature wire cutters, and this is distal end cutter. So the distal end cutter, this is flush cut distal end cutter. What is meant by flush cut distal end cutter means, when we want to cut the wire, we can hold exactly to that particular place and we can cut, so there won't be any of extra wire remaining after this. So this is very important when we are working in the lingual, because even a small 1 mm amount of the wire comes extended distal to the molar tube. It will create severe irritation for the patients. So these are the basic 3 cutting instruments which will be useful in the lingual practice. Next, this is the wean guard plier. So where the tip will be so much narrow with so much long arm, so for holding the wire and to engage into the bracket slots, it will become easy. And next, very important instrument when we are doing in the lingual practice is night eye cinching plier. So this night eye cinching plier is useful for making the cinching of night eye wires like this distal to the molar tube, so it won't cause any of the irritation, especially when it is in the rounded wires, because the wire should not come out from the molar tube and it should not hang. If we cut the wire completely, then it may sometimes come out and causes irritation for the patient. So for making the cinching of the wire, this is very useful instrument, and main advantage is like we don't want to burn the night eye wire for making the bend. If you are burning the night eye wire, automatically the properties of the night eye will get looser. This is debonding plier. Here also, if you see, the arm is so much long and we are having the beaks which are so much thin compared to the labial plier. So if we see the labial instrument, see, it is so much big which can't able to hold. If we want to hold the bracket, it comes into the interference. But with this, it will be easy for holding and for debonding. So this is debonding plier. Next is coming to the Matthew pliers. So for making the work, either to make the ligation or to engage the elastics, the Matthew plier tip should be so much narrow, so that it will be very easy to perform in the lingual setting. And in that, it is straight one and this is curved one, which will be useful for making the lingual work so much easy. So now, as a summary, if we want, these are the bracket tweezers for the bonding procedure. This is for the posteriors and this is for the anteriors. This is the selfie lingual tool for the bracket opening and closure. This is for the checking of the measurement, that is periodontal probe. And next is the cutting instruments, like you are having pin and ligature wire cutter, which is straight one and which is curved one. And next is you are having distal end cutter and wean guard plier, night eye cinching plier, debonding plier, and Matthew pliers, which are straight and curved. So these are the basic instruments which are required for doing a basic lingual practice. So next, when it comes for the bending instruments, mainly for making the lingual arch form modification, for that these are the basic required instruments. Those are lingual offset bending pliers. In lingual offset bending plier, we are having 3 mm, 2 mm and 1 mm instruments. So this instrument will be useful for making offset bend or otherwise step bend for making the incorporation in the wires. So for either giving in canine offset or premolar offset or molar offset, we will be using this instrument. So the next required instrument is ribbon arch plier, which will be useful for making the bends in rectangular wires. So for making the bends in the rectangular wires, it will be requiring. And next is bird beak plier for making bends in round wires. For that purpose, we will be using the bird beak plier. And De La Rosa plier without serration. This will be so much useful for making the forms, lingual forms for making. For that purpose, it will be useful. So, these are the basic instruments which will be requiring for making the bend. So, after making the lingual form by using these offset bending pliers, we can incorporate like the bends according to the required way into the lingual wire, either in round wires or in rectangular wires. So for making the fit for lingual purpose. So these are the basic instruments which will be useful for the bending purpose in the lingual.